Hello, everyone. Again, welcome to our community health promotion. Women Health First presenting today. Monkeypox. Monkeypox has been there. We've seen the prevalence and cases in the United States, such as endemic disease in some places around the world, predominantly in Africa. Now we're seeing the incidence and prevalence here in the United States. I'm Nahila Ayeva. I'm a research analyst, public health analyst, educator with a background in public health communication, public health information, research, and also I have a background in doing Islamic education and comparing public health education and Islam. I do that also for Muslim sisters to see exactly how that overlap or how that have a similarity. So today we'll be talking again with my co-presenter. Dr. Olaoluwa is a MD, a medical doctor who also has been a great, valuable member for Muslim community, as she's also a lead teacher for Sisters Halaka, which is a Islamic education for women. She values a health issue with a woman in Islam. She also pioneer for domestic violence prevention in our Muslim community. And I would like to welcome Dr. Jemilah, who will do this presentation. Thank you.
Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum salam. And this presentation is a mix with a lot of Muslim and non-Muslim alike. So we can just...
Good afternoon, everyone.
Yes.
Good afternoon, everyone.
Good afternoon.
Welcome to our presentation. Thank you, my amiable sister Nahila, for having me presenting with you today. Thank you so much. It's my pleasure being here. We'll be discussing monkeypox. Like we all know, monkeypox is a rare disease caused by monkeypox virus. The monkeypox virus usually affects rodents, such as rats or mice, or non-human primates, such as monkeys, but it can also occur in people. Monkeypox usually occur in Central and West Africa. Cases of monkeypox cases outside of Africa are often due to. So what I'm trying to say is that monkeypox are mostly seen in Central and West Africa, but in cases where they are seen outside Africa, they could be due to this international travels. Like we all travel around, you can transport diseases from one place to the other. We can import animals. Through imported animals, monkeypox can be transported. Close contact with an animal or person with monkeypox. The Center for Disease Control and Prevention, CDC, monitors cases that have been reported in countries that don't often have monkeypox, such as United States. The CDC is monitoring many cases of monkeypox throughout the world, including Europe and the United States. What are the symptoms of monkeypox? That does monkeypox look like? Monkeypox symptoms may start from 5 to 21 days after an exposure to the virus. That means one can get infected with monkeypox between day 1 and 4, but the signs and symptoms could start presenting from 5 to 21 days. The time between one's exposure and the manifestation of the symptoms is what we call incubation period. Like we all know, most viruses have their incubation period, and that of monkeypox is from 5 to 21 days. Now, the manifestation of the symptoms itself could last between 2 to 4 weeks, and it may include the following. 1, it may include fever, skin rash, which is one of the main symptoms of monkeypox, headache, muscle aches, and backaches, chills, tiredness, swollen lymph nodes. About 1 to 4 days after one has begun having a fever, a skin rash I start. The monkeypox rash often first appears on the face, where we might go to the slide of the skin rash. I'm sorry, the picture might be disturbing, but for educational purposes, we might need to see how the skin rash looks like in a monkeypox infected person. The monkeypox rash often appears on the face, appear first on the face, then it might spread to the hands or feet, and then spread to other parts of the body. The monkeypox rash goes through many stages, as we can see even from these pictures. The monkeypox rash go through flat spots, which could later turn into blisters. Then the blisters fill with pus, scape over and fall off over a period of 2 to 4 weeks. So monkeypox can get, you can spread monkeypox while one have symptoms. You understand? So from when when your symptoms start until your rash and scabs heal, one can spread the virus itself. How does this spread? I said it's from the moment one is infected with the virus, from the day one, before the appearance of the skin rash, it can actually spread the virus itself. It can be spread through direct contact with the rashes, with the scabs, or body fluids of a person with monkeypox, like from the pus, from the fluid that comes out of it, one can actually infect the other person. Extended close contact for more than 4 hours with a respiratory droplet, maybe somebody cough or speaks into the air, it can last for 4 hours. If somebody, the other person can be infected with the virus itself. Because we are talking about droplets, that means even with true sexual intercourse, the virus can be transmitted. Clothes, sheets, blankets, or other materials that have been in contact with rashes or body fluids of an infected person could actually be a means of transmission of the disease. An infected pregnant woman can actually transmit the unborn child with the monkeypox virus. From here, I would like to pause for Sister Nahila to take us through the prevention. Capable Sister Nahila to take us through the prevention and the Islamic approach to health.
Thank you so much, Dr. Olaoluwa. We really, really appreciate you. MashaAllah. That's a great presentation. Yeah. Like you hear from our beloved doctor, she's mentioned that usually this disease is not in here in the United States and is done through the migration, and international travel. Yes. So, but as we can see, we have a recent case of a breakout, in May in 2022 in the United States. And this is very serious endemic and become a pandemic as well. Yes. Before prevention, which is a key element of today's presentation, we also would like to look at the Islamic approach to the health. So for those who are Muslim and also those who are in a healthcare profession who dealing with Muslim patients, sometimes they kind of feel like, is a Muslim people take a medicine? Well, absolutely, yes. And not only that, they also take preventive approach. So that's why it's very important that we like to reiterate that today before we can move on our preventive measures. Yeah. Prophet of God, Muhammad, peace be upon him, says what? He says that the wealth is appropriate to a God-fearing person. But he emphasized that the good health is better for God-fearing than the wealth. As you can see, is a correlation in the health study saying that health care statements say prevention is better than take a lot more preventive approach to the disease, to preventive the disease more than even thinking about the disease. And as I was mentioned earlier, is that the prophet of God, Muhammad, peace be upon him, he has emphasized that the health is important than the wealth. He says, wealth is appropriate to a God-fearing person, but good health is a better for God-fearing person than the wealth. He further says that he of you who find himself enjoying a good health, securing in his community, and then has a daily subsistence, he has the whole world out of his fingertip. That's profound. That's profound. That's how Muslim people value the preventive health, which is to prevent disease, right? So Islam has prioritized the health and placing it as a second in importance on their faith. Yeah. Islam also encourage a human to take measures to protect body from harm and from preventing them from the disease. The most important thing that we see here is that the cleanest rituals that Muslim people perform before their prayers every single time they pray 5 times a day is nothing else than preventive measures. As Dr. Olaoluwa mentioned earlier, she emphasized that when the smallpox disease started to spread, the disease affect the eyes first, the facial. Why is that? Because we have a tendency to touch our faces, So that's how it is. But the ritual, Islamic rituals such as wudu, for those of you who are not familiar, wudu is they wash their hands, purification before they perform their daily prayers, which is also called salah. So doing that 5 times a day can alleviate the problem of carrying pathogens such as viral or bacteria on the hand. So, and some Muslims even go a little further to wash their hand with a soap before even performing wudu. So that also is a way of eliminating those micropathogens from our hand before. So that exactly line, in a preventive measure that we see in a public health. The evidence of the statement that I made saying that Muslim people take even a greater step on preventive measures is that in their holy book, the Quran, chapter 2, verse 195, it says, and make not your own hand contribute to your own destruction, arms. So in these cases, touching your faces and putting your finger in your mouth or doing anything, this verse can be a little bit vague, as scholars of Islamic knowledge can elaborate more. It can also be a domestic violence, harming people with your hand, doing bad stuff with your hand, go stealing with your hand, doing every single thing in your hand. But then in this concept of disease prevention is one of the verse that is used, that scholars are using for saying that hand touching, because bacteria and the virus are very critical for our health, and those are the destruction. Especially we see not just a smallpox, which is less harmful, but the COVID-19, and we see how COVID-19 was devastated, giving a fatality and morbidity rate very high. We see a lot in here, and it's on. Is more devastating than killing. It's like more devastating than a weapon, So if it's something that is not harmful, we should be able to contain them right away. We won't be even if we will be able to use extra forces like a military, because the U.S. has a strong military, defense. But we couldn't defend our country when COVID-19 struck us in here. So this is the context of all this verse that I just mentioned, that your hands, keeping them clean, keeping them pure will prevent the disease. And that's Islamic approach to public health and to preventive medicine. Yes. We're going to move on to the next slide, which is prevention. gonna go back to one slide, which is the prevention. Yes, prevention. Like I said, I can no longer then emphasize again one more time on the importance of hand washing. It's very crucial that we wash our hands, not just when we are in touch or in contact with people with a disease. In case of a smallpox, you don't have to see somebody with an outbreak on their skin in order for you to wash your hands. Anytime you come in contact with anybody, you greet somebody in your hand. Do not go to eat food. Do not go touch your face with your hand. It's very highly recommended that you wash your hands. Very important. It's very important. You wash your hand when you use a bathroom. You wash your hand even if after you use a tissue. You wash your hand after you eat food. You wash your hand after even having an intercourse with your husband, your partner. Is crucial because in case of monkeypox virus, the incidence and prevalence have been seen more in a sexual activity. Is also contaminated, highly contaminated during sexual intercourse or even a kissing and touching. And the prevalence of these diseases have been seen among the MSM, which is a man sleeping with a man, or also among the lesbian and gay community. So CDC has been doing research and really contain the disease among that population. That being saying, it doesn't say that it's just those people who can get the disease. It's for everybody. Everybody can get the disease. So it's very important that we isolate ourselves from people that we see clearly that they have a lesion on their skin. Wash your hand with the soap is a very requirement, especially when we touch animals. It's very important that we continue washing our hands. Hand washing is I can emphasize, I can only overemphasize, and it comes to the point where one of my program, a participant tell me, hey, how possible people in Africa who don't even have water to drink can possibly wash their hands to prevent diseases when you really emphasize hand washing? Absolutely. It is a great concern. How possible? How possible? So it's an issue that we also need to tackle. Providing clean water for people in a vulnerable population who not only can consume the water, drink the water, utilize them in their daily activity and cooking food and and the crop, also growing the crop, but also to wash their hand even if they have not taken a shower. It's very crucial that we wash our hand, right? Consistently hand washing is a factor of preventing all the diseases. All the diseases, I'm telling you, all infectious diseases are preventable up to 50% according to researchers, based on with soap and clear water than other diseases combined. So 50% of diseases are removed from up to 50% removed from your hand, and you'll be safe. So preventive measures are very important, and it's very important in this case of monkeypox virus as well. So another preventive measure is a vaccination. Well, your healthcare provider may require or advise you to vaccinate it, based on the incidence of prevalence on your area, or based on your family history, or somebody in your household, or sometimes you bring your child to pediatric appointment and that person have the child already have a smallpox. So in that case, they will advise the mom to also go ahead and have the vaccination to prevent themselves, right? But at this point, at this current point of time, CDC does not emphasize and does not require people to get vaccinated for monkeypox virus, because monkeypox virus with a strong immune system can wipe himself off with the preventive measures that we previously mentioned: hand washing, eating well, and physical activity, and have a healthy immune system can wipe those diseases quickly. So at this point, we also align with the CDC, the Center for Disease Control and Prevention, and say that if your healthcare provider does not really tell you to get vaccinated, then do not vaccinate yourself for smallpox. But we highly recommend that you do that for COVID-19. Right. So for those of you who choose to say that they're going to get vaccinated, well, how much it costs? What is the cost of the vaccine? Well, the cost of vaccine here, we do not know until today or until yesterday when we finished this PowerPoint presentation that is free. It is not, because since it does not become a public health threat, the government did not take it on his hand to make it free vaccine like in the case of COVID-19, right? But if you have a health insurance and you are interested to get vaccinated, regardless of your preventive measure, you feel like it's something you need to do, then you can talk to your insurance provider and see if they cover for small chicken pox. What is that? Monkeypox vaccine. They are all related because it's all pox. So yeah. So forgive me for that. Here we're talking about monkeypox vaccine. So check with your healthcare provider and see if you are elected to do so. If not, another great place to also inquire about the vaccine is your public health department, community health centers, and that you also can reach Women Health First to receive a referral for community centers who provide, sliding fee or sometimes free vaccination based on your immigration status or your inability to pay or not having insurance. Yeah. At this point, we come to the conclusion of this presentation, and we would like to ask you if you have any question, comments, clarity, and anything that you would like to bring to Gem to this, and then we will be able to really answer your question. As I said earlier, Dr. Olaoluwa, she's a medical provider, and she understands the viral infections, and then she will be able to answer some of your questions. And I also am here to answer more questions about preventive measure. Thank you so much. Thank you so much. We really appreciate you. With this presentation, we will use the two guidance reference that we use. We use the CDC recommendation for monkeypox prevention. So we use their site as well for guidance. We also use a Mayo Clinic to get a research deep in terms of etiology of the disease, where is it really coming from, why, as my colleague has mentioned earlier, my co-presenter, that this has been seen in America because of international travel. It's not a tradition, it's not a traditional disease that we see in here, as she previously said, is a rare diseases that has been seen. So again, Mayo Clinic is a researcher. They have no biases. They are a non-profit organization, but are high in the research. So we use those as a peer review and also validation this presentation for you. So thank you again so much. And without further ado, we would like to answer any question that you may have. Dr. Jemilah?
Thank you so much, Sister Nahila, for the beautiful work and the beautiful presentation. Just to make more points on the monkeypox virus, monkeypox disease itself is not as transmissible, as easily transmissible as COVID-19 itself. You understand? It's not, even when we stay in contact with some people, if it's not so for a long time, most likely we are not likely to get infected with the monkeypox virus itself. You understand? And then when we get in contact with the person that is manifesting the disease, when we take some precautionary, like some health precautionary measures, like my sister Nahila has rightly said, like hand washing, maintain some certain level of distances, and then of course the use of face masks that we are still using right now. It could serve as a kind of preventive measures for the disease itself. Then in the case of healthcare workers or people that are taking care of people with the diseases itself, they might, those people that are laundry, they are launderer, they take care of clothing and what have you. When you take precautionary measures, it serves as a kind of preservative, means of preserving or excluding or protecting ourselves from getting infected with the disease itself. So if you have somebody with the disease, even as a member of the family, the person has to maintain quarantine is very, very important in this condition too, as we all know that is also a viral infection. Most viral infections, when we quarantine or isolate the diseased person, it helps a great deal. You don't say because you try as much as possible, especially if it's a close member of the family, maybe if it's a child or the father. If it's the father or the mother, you can isolate yourself in one of the rooms. If it's a child, you try as much as possible to isolate yourself, protect yourself. The spray of the air in the house is very important with 99% antiviral, like Clorox, what have you, that we can use in the house. The cleaning of surfaces and contacts in the house that we all touch. Maybe the knobs of the doors is very important. We wipe them with Clorox. The cleaning of the surfaces from time to time. All these preventive measures help in the continuous transmission of the diseases. And of course, our health, what we eat intakes, the fruits and veggies, they are very important in boosting our immune system. When our immune system are boosted, they will naturally fight all these disease conditions, the ones that we know, the ones that we cannot see. Our body immune system will fight naturally by itself. Those are very, very important things. Then we have to drink a lot of water. Water helps in flushing down whatever thing that is coming or whatever thing that is within the system. It is very important. We have to eat healthy, clean our environment, make sure we stay in a healthy, clean environment. All these things, they help a great. That's all I have to add to the presentation. Thank you.
You're welcome, Dr. Olaoluwa. We really appreciate you. Again, the floor is open for questions, and I would like to call on Sister Shirlene. Do you have any questions?
Yes, I had a question. I wanted to know, what is the incubation period? What if you don't know you have it and you've been around it? What is the incubation period before you recognize or you know you have it?
Yes, the incubation period that Dr. Olaoluwa, as mentioned earlier, is from 5 to 21 days. And if she would like to elaborate on that, she can.
Yes, like thank you, Sister Nahila. Thank you, Ms. Shirley. Like I've rightly said, the incubation period for chickenpox virus itself is from 5 to 21 days from the day of exposure to the virus itself. So it's between 5 to 21 days. That's the incubation period. But from the day one of getting infected with the virus to the day 4, somebody might not have manifested the symptoms. That person can still infect people, even though the person have not started manifesting those symptoms that we have rightly said. But the incubation period is 5 to 21 days.
Thank you. So they're considered contagious. They can still be contagious in that first to 5 days, but you would not know it because you would see nothing. Is that correct?
Yes, yeah, absolutely. Yes, correct.
So,
that's correct.
Yes, absolutely. Yes, that's correct. So by the time one starts manifesting some of the symptoms of the diseases, then you can assume that you are within 5 days upward from the first day of manifestation of the symptoms.
Okay, thank you.
You're welcome.
Any other questions? All right.
Okay. I had a quick question, Sis Nahila. Can you still be a carrier of this and not manifest all the symptoms and still be carrying it?
Absolutely, absolutely. You know, that's why some people with a strong immune system are the one that we supposed to fear. And since it's now already in their head that they are having a viral, that's why the preventive measures such as a simple hand washing are so crucial. We cannot emphasize the importance of hand washing before touching your face. And if that is the case, let's say somebody want to scratch their face and they don't have water, they have to open their back of their clothes like this and wipe their eyes, but not in here. Don't touch with your hands. All those important things are, measures are very important because we don't see the viral. Unfortunately, it's not seen. And the people who look healthy, very healthy, can carry still the disease, carry the virus, and contaminate other people who will be sick, but themselves they're not sick. They don't even have any symptoms. It happened in many cases when it comes to viral infection. Unlike a bacterial infection, whoever has a bacterial infection, it can very manifest by runny nose, cough, icy throat, or whatever. They will show the symptoms right away when it's a bacterial infection. But when it's a viral infection, like Dr. Jemilah has mentioned, the incubation period already has started prior to the disease, but you know because again they did not show any symptoms. Yeah, so we have to continue washing our hand, and take our vitamin C's and protect ourselves, and our intake, of nutrients should be really the one that promote our health and not over calories that we see today at our diabetes class. The calorie that is not needed, we don't need those. So we need the nutrient because with the nutrients we can fight those diseases, and then that's the best way even instead of taking medicine. Prevention is better than a cure. Thank you, Shirley.
Thank you. Thank you,
You're
Dr.
welcome.
Olaoluwa. Thank you, Sis Nahila. Thank you, both of you.
You're welcome. You're welcome very much. We would like to call on Sister Fatu. Sister Fatu is joining from Canada. Sister Kine?
Yes, assalamu alaikum wa rahmatullahi wa barakatuh, my sister. Hello, Actually, I'm just so sorry I couldn't connect earlier. So I missed part of the presentation. So I cannot make any comments at this point, subhanAllah, because I missed too many things. So I'm just listening. I'll stay as a listener and enjoy, inshallah. Barakallahu fiki for inviting me.
Oh, yeah. We're going to have it, how you call it, it's recorded, so we will have it a replay in a form of YouTube or also in a podcast. So we will edit it and you will have it.
Inshallah. Jazakallah khair. Assalamu alaikum, all sisters. Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Yes. Well, any other sisters? We have a couple more minutes left before we can wrap it up. Dr. Yusuf, you would like to hear from you. Yeah. Any question, any comments, and what are some of the recommendations you may have for this presentation?
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
I would like to thank Dr. Olaoluwa for the presentation. I enjoyed the last part, and that was also very educative for me. And then I also like to thank Dr. Nahila always for putting this together. And I enjoyed that part about the wudu. A lot of us don't know that the wudu is also very important. It's not only about worship, it's also helping our health. So thank you so much for this refresher. It's very good for us. Thank you so much.
Thank you for coming.
Thank you so much, Sister Bedemi. We appreciate you. One more thing that I would like to also emphasize is that once we're doing the preventive measures, it's not just for us alone, So we have to also think about our community, our massages, our kids' schools, because the kids are easily taking those, touching their faces, touching their hand and bringing home as well. So their school, public library, you can volunteer your time like a sisters and ASHA here in Women Health First, Islamic Sisters Group and Support. always go and once a week, once a month, disinfect and sanitize the masjid, you know. So as you can see in the picture on your right, depending on how your skin is, that is a sisters of disinfecting the masjid inside and then touching stuff. Because again, when it comes to Muslim prayer, your two hands go to the floor, you know, and everybody else already pray there, you know. Although we do know that before prayer, you have to consistently wash your hand and do your wudu, purification. Nevertheless, some people come to the masjid quickly, open the masjid door before they go inside the masjid to purify themselves. So you may go and pray clean when you're coming out and you're touching the door. So that's why you're carrying the extra, you know, viral or bacteria in your hands. That being saying, it's always important that when you have extra time, you have to, you know, do something to help your community so that you can volunteer your time to disinfect and sanitize not just the masjid, the public library, your child's school, your church, your synagogue. It will be a great thing for you to do, because once everybody is healthy, then the community that is healthy, the nation is healthy. Okay, so without further ado, I would like to call on Dr. Jemilah to give us a closing argument, and then we will dispatch from the meeting. Yeah, thank you again for everybody. Thank you. Dr. Jemilah.
Thank you so much, everybody, for coming. Thank you so much, Sister Nahila, for giving me this opportunity to present this topic. Since we all agree that health is wealth, and Professor Salam said a stronger and a healthy Muslim is better than a sick one, because if you are sick, you will not be able to do anything for yourself. You will not even be able to worship your Lord, your Creator. You will not be able to help your community. The same thing even for those people that are not Muslim. We know that health is wealth. We don't want to be sick. We want to be able to take care of ourselves, help our community, to be able to go about our regular or daily life normally. So in that sense, we should try as much as possible to put in some preventive measures, not just for monkeypox virus or disease alone, for other ones that are even going around in our environment that we cannot see. A lot is happening at the ER. A lot is going on in schools. Let's encourage our kids to go with at least those small bottles of hand sanitizers. And then when they come back from school, maybe when they are coming right into the car, maybe we get to pick them up, let them sanitize their hands. It's not easy. Most times we forget. I also forget. This I'm saying, I'm also using this opportunity to remind myself of these things that I'm saying, because we forget. Because right now, the kids are going back, I mean, they are coming back home with different symptoms. So much, it's so bad. And these ones that we are having now is even different from the ones that we had in last year. This backache, headache, you know, looks like this, but they are not manifesting with rashes. So you can't say it's monkeypox, but it's like, you know, viral conditions, they are family. So let's try as much as possible as at the same time to take our nutrients seriously. Fruits and vegetables, veggies, they are very, very important. Let's try and not overcook our vegetables. Let's make sure at least once or twice in our meals daily, we have vegetable in them. It takes a lot of water. And let's try as much as possible sanitize our environment, our houses, clean our surfaces and contacts. They are very important. Thank you so much for having me. May God protect each and every one of us. Thank you so much. Thank you so much.
Thank you so much, Dr. Olaoluwa. We really appreciate you. And thank you so much for all the audience has been taking time out of their busy schedule, a beautiful Sunday that you're relaxing, enjoying. That means your health is important. We really also value your health. Thank you so much. This brings us to the end of this presentation. And again, we will see you again in 2 weeks for another presentation. And for those of you who taken our diabetes prevention classes, this is weekly, and we will see you next Sunday. Thank you. Thank you again. Thank you so much. And bye-bye for now. Bye.
Bye. Thank you for coming. Bye.
Bye.
Bye. Thank you, everybody.
You're welcome. Thank you.